Hello, I'm Paul Moss. I'm Chief Investigator of the UK Coronavirus Immunology Consortium. It's been a tremendous privilege and responsibility over the last 12 months to play our part in helping to do whatever we can to lead towards control of this terrible pandemic. This was very much a translational research program. We wanted to make a difference for patient benefit, and that's been at the core of everything we've aimed for. To do that, we want to thank everybody who's helped to contribute.
I would just like to say a huge thank you, not only to the patients who participated in all this research, but also their relatives, and most importantly, the NHS workers who contributed so much to our data sets. There's never been more research done into understanding, the basis of disease and therefore how we might treat it, but also understanding how vaccines work and how we can use vaccines. There's never been as much research done, and that really is down to everyone.
We have been trying to understand disease severity by analysing patient samples. Now, we understand that when patients are in hospital, it's a very anxious time, and so to repeatedly give permission for your blood to be withdrawn is an extremely courageous thing to do, and so we'd like to say a massive thank you to the patients.
The donations of patient samples that you've all given have been vital to the success of UK-CIC research's outputs, and we're very grateful to all of you who have donated samples that we've been able to use for immunology research.
Each and every sample has been very precious, and I think the outputs have been very important. Everybody who's participated in whatever kind of role, I think it's been an excellent effort. So thanks.
None of what we have achieved would have been possible without the NHS staff that have donated their time and energy into getting these samples to us. So a massive thank you to those two.
So we've been studying healthcare workers, lab volunteers and medical students, and absolutely everything that we've done has been totally dependent on the really generous blood samples that you've all given us.
I just wanted to give a massive shout out and thank you to everybody who's provided samples for our researchers to look into coronavirus.
I'd just like to take this opportunity to thank everybody who's been involved as a participant.
We would like to say a big thank you to all our patient participants for the samples they gave us and allowing this research to happen. Thank you.
We couldn't have done any of it without you, so a very big thank you from me and my group.
What you might not realise is one of the limiting factors for doing biomedical research really is access to samples. And humans are highly variable, and we often need to look at a wide and diverse range of individuals to truly understand what's happening with a disease. In particular, I'm really grateful for individuals who have come for repeated testing so that we could look at what's happened over time in individuals.
It's thanks to you that we've been able to carry out so much good research. So thanks again.
Our work wouldn't be possible without the donation of patient samples for our research. Patient samples are probably the most precious things that scientists have in their laboratories, and the fact that some of these samples were donated when people were very sick indeed makes them even more special. Thank you to everybody who's donated samples for COVID-19 research.
Thank you.
Thank you. I've spent the last 18 months studying the immune response following COVID infection and vaccination. And I just wanted to say a very big thank you to everybody that has been involved.
So thanks a lot for contributing your time and effort to research over the last year. It's really been essential for the rapid development of treatments, vaccines and health policies against COVID-19.
We're researching whether SARS-CoV-2 evades the immune system and whether antibodies can activate immune cells. We'd like to say a big thank you to all the donors who have contributed samples to our studies.
We are very thankful about your donation of the tissue samples and the blood samples for promoting the research that we are doing.
All the patients, all the healthcare workers, to the laboratory staff who have worked tirelessly to process and produce the results that have meant so much to so many. Thank you.
The UK Coronavirus Immunology Consortium has been a big effort by many different sectors in science to bring together all the knowledge in immunology with COVID-19 And I would like to thank, firstly, all the scientists who have participated in this, the very open way that you've been able to share your information and data. Not least of all the people who've actually donated samples that have enabled us to carry out this research.
Thank you, and thank you as well.
None of it would be possible if we had not been able to get samples from people who have COVID infection to help us understand what is happening to their immune systems during this horrible disease.
Thank you so much for your help.
So if it wasn't for the selflessness and the courage of the relatives of the people who have sadly passed away of COVID to donate the tissue to our work, we wouldn't have been able to achieve what we've achieved. So I would like to really thank those people and those families.
Thank you to all the immunological community in the UK and all of those people who've contributed their samples to help us understand the disease.
Sample donation has been so utterly critical to our work, and we feel that we're in a very strong position now to understand a lot more about this terrible disease. Thank you again.
So I just want to thank everybody within the UK, patients, staff at all levels who've helped us over the last 12 months. We hope we haven't let you down. We don't think we have. We've made a major contribution, but thank you for what you've done for us.